If you have a patient that needs some assistance to sit at the edge of the bed, follow these steps. Use the bed to your advantage by lifting the head up a little bit and lowering the bottom portion to flatten the legs in the bed. Utilizing similar technique to assisting a patient with rolling, lift the opposite knee and have the patient reach across their body with the opposite arm toward the side they will be sitting. Roll the patient while supporting at the scapula and bent knee. With the patient on their side, help the patient bring their legs off the bed. Then instruct them to push up with the elbow or arm that is against the bed. You can help guide and support the patient with a hand on each shoulder. To get the patient back into bed from this position, first lower the head of the bed. Then instruct the patient to slowly lower themselves onto their elbow and then their shoulder. You'll guide them down with your hands on both shoulders. Then lift their legs back onto the bed and assist them as they roll onto their back. If you have a patient that needs a lot of assistance to sit at the edge of the bed, follow this two-person technique. Use the head of the bed to your advantage by lifting the head up and flattening out the bottom portion of the bed to flatten the patient's legs. One person will assist the patient with their upper body, and one person will assist the patient with their lower body. One provider will begin by bringing the patient's legs off the edge of the bed. Ensure that both the patient's heels are completely cleared of the edge of the bed. Both providers should position themselves with a wide stance to ensure a wide base of support. The provider controlling the patient's lower body will assist the patient by grasping the draw sheet on either side of the patient's waist. The provider controlling the patient's upper body will assist the patient by grasping the sheet underneath the patient's shoulder blades. Before you reposition the patient, either ask or help the patient to position their opposite arm across the chest, similar to the technique used for rolling a patient. Both providers will assist the patient to the edge of the bed by weight shifting the patient's hips forward and the trunk upward via sheet assist. The provider controlling the patient's lower body will use their knee to block the patient's legs and prevent the patient from sliding off the edge of the bed. The provider controlling the patient's upper body can assist the patient by providing support and stability to the patient's back. To return the patient to a supine position, lower the head of the bed. Then work together to safely and slowly guide the patient down onto their shoulder. Lift the patient's legs onto the bed and guide them as you roll them onto their back.
Guide them and roll them slowly onto their back.